The topic of today will be therapy and how it can be useful. Therapy can be rewarding, and embracing it can lead to a healthier and more stable life. When a baby cries, we don't particularly know exactly what they want because they can't tell you what is wrong. But you try to feed it, check its diaper for any accidents, or maybe move the little legs in a circular motion to see if it's a gas. Trying to figure out how to calm a baby down is similar to what it's like when we feel an emotion, but we may not know how to express it exactly, so we can get the help that we need to feel better. There may be some trauma that prevents us from being able to speak up like other people who have not experienced trauma, or maybe we were born with a mental illness, but there is help: therapy. Hello, everyone. My name is Brandy Ryan. I'm here to discuss therapy and why we should use it to be healthier, functioning people. Being born into this world is where it all begins. Our environment and individuals that we grow up with in our lives have an influence on the type of person we become as individuals. Genetics also plays a role as well. I want to discuss 5 out of the 10 types of mental disorders, statistics, and types of therapy. There is a reason why we have a month dedicated to mental health awareness. Mental Health Awareness Month has been observed in the U.S. since 1949. People from the National Alliance of Mental Illness said, "Together we fight stigma, provide support, educate the public, and advocate for policies that support the millions of people in the U.S. affected by mental illness." Mental illness is a very serious topic. It can be very sensitive for some. There are 10 types of mental health disorders one can experience, but I will be sharing 5. Starting off with a common one is called anxiety. Anxiety symptoms include sweating, muscle tension, chest pain or tightness, or shortness of breath. Next, we have mood disorders such as bipolar disorder, depression, and glycemic disorder. These individuals will feel hopelessness, loss of appetite, binge eating, low self-esteem, and risky behaviors or symptoms. Number 3, psychotic disorders are characterized by distorted awareness and thinking. Schizophrenia is a common example of a psychotic disorder and will show signs of hallucinations, delusions, lack of emotion, or disorganized thoughts or speech. Number 4 is personality disorders. People with personality disorders have unhealthy, inflexible thoughts and behaviors that may pose serious problems with relationships and work. The types of personality disorders are borderline personality, narcissistic personality, and antisocial personality disorder. The symptoms associated include lack of impulse control, mood swings, anger outbursts, and inability to admit their faults. Finally is post-traumatic stress. PTSD develops after a traumatic experience such as sexual assault, physical assault, natural disaster, or death of a loved one. Memories of the trauma may have disturbing effects on the person. The symptoms with PTSD include trouble sleeping, having flashbacks of the event, avoiding places or people, and intense feelings of anger, fear, or worry. Depending on the mental disorder, there is treatment available. Treatment will be very specific to the disorder, event, and age of the individual. There is a known increase in criminal and suicide rates in those who have mental disorders. Depending on the disorder, some people may fall into a path they normally wouldn't if they had chosen to get help. An estimated 2 million times each year, people with serious mental health conditions are jailed or imprisoned in the U.S. Women are disproportionately impacted at twice the rate as men. For this population, incarceration may exacerbate pre-existing symptoms, says Carolina Estevez, doc, a clinical psychologist in Miami. The trauma and stress associated with incarceration has a potential snowball effect, exacerbating existing conditions and potentially contributing new diagnoses such as depression, anxiety, PTSD, and substance abuse substance abuse, adds Dr. Estevez. According to the National Alliance of Mental Illness, individuals with mental health conditions are more likely to experience incarceration. Additionally, those who have health care coverage following their release and presumably the access to mental health services that affords may have less risk of recidivism. There is not a single type of therapy out there as a cure for all. Depending on the issue at hand, there is a specific type of therapy that can be used to help. The type of therapy available to people include cognitive behavioral therapy, CBT, dialectical behavior therapy, exposure, animal-assisted, emotional-focused, play therapy, and eye movement desensitization and reprocessing therapy, EMDR. When using CBT, cognitive behavioral therapy, together the therapist and their client can work on developing constructive ways of thinking. These changes can offer a healthier, more positive outlook and help a person change their behavior and beliefs. Dialectical behavior therapy helps create a balance between change and acceptance. Psychotherapists first developed DBT to treat people with borderline personality disorder who are experiencing thoughts of suicide. Animal-assisted therapy is using trained therapy animals to help reduce anxiety and PTSD in individuals and is often seen in medical facilities. Emotion-focused therapy shows someone how to figure out their emotions and express them instead of suppressing them. Next, children in play therapy may show their feelings or experiences through how they play. This type of therapy allows a child to deal with behavioral problems, stress, or trauma, or trauma in a safe environment. Lastly, EMDR requires bringing up a traumatic event while having eye rapid movement to give an opposite effect and not make the event as painful as before. Unfortunately, we can't always stop bad things from happening to us because sometimes we're born with a mental disorder. Data has shown an increase in suicides and crying for people who don't get help. There are different types of therapy available and doesn't have to be just when something is wrong. It can be used even when you're happy to. Thank you for listening, and I hope this gives someone out there a push into a healthier direction. Thank you.